Today we are going to be looking at the most distal bones and joints in the foot. That's those of the phalanges, or toes, as they're more commonly known. It's important to remember that whilst these joints and toes should be able to move in all three planes of motion, remember our little reminder that we have here, we're going to be primarily looking at flexion and extension. So flexion is when the toes tuck under, and extension is when they lift relative to the forefoot. For the quick assessment, we are going to be seeing whether or not you can move your toes in a kneeling position. So can you have your toes fully flat against the ground in this position? Can you tuck them under and bring them round so they all engage, including this fifth little toe? So again, down flat, and up, and round. Do you get that engagement? Another mechanism to look at this, and it's primarily looking at toe extension, is in quadruped, where we can do a pelvic rock, like so. And what we're looking to see is whether all of the toes can actually stay in full engagement in the floor in both positions. So here and all the way through here. If you find, and it's, normally people have issues with their little toe, that it's doing something a little like this, then obviously there's a mobility issue there that you need to look at. Some people are going to have lots of issues, so they're kind of in this position and they don't have that engagement. This is a real good indicator that you need to do some work on these lateral toes through here. Once you've identified which toe or toes need the work, we need to know what it is that we're going to be doing. So whilst we're primarily working in flexion and extension, so reminder, extension this way, making sure you get that little toe as well, flexion bringing down this way. We need to remember that whichever toe it is or toes you're working on, they need to be able to work in all three planes of motion. So basically that means you want to be able to work this way and this way, you want to be able to come out and in, and you want to be able to rotate it inside and out. Okay, so you can do that to all of the toes. You can also use a little traction like so. Do that for all of the toes, just to increase the joint space in there as well. After we've done the manual mobilisation and increasing the joint space with our hands, you can also use a ball. The ball is also great for just general toe mobilisation when you're not really paying a huge amount of attention to what it is that you're doing. If you need to do some work on your toes, this is a great way of getting some mobility in there whilst you're sat at the desk, whilst you're watching telly, those kind of things. For a loaded approach, we're going to be taking the toes into extension to begin with. We're going to bring our body weight through and onto our metatarsal heads. I'm going to start off with the big toe, and we're going to go all the way through and round to that little toe, making sure we're loading that. Same as we've done before, pay attention to your body. What's it saying? What's uncomfortable? What's not feeling quite right? What makes your breath change? We can take that all the way back. For flexion, we can tuck the toes under, and exactly the same. We're going to load up the big toe. Ooh, little pop there. We'll take that round to the second, to the third, to the fourth, and to the fifth. And then back again. I hope you found those useful. Any problems, comments, etc., just let me know. Obviously there's the self-care routines that you can go through in the separate video, which I will tag at the end of this one. But I wanted to talk a little bit about why it's important to have good toe mobility, particularly in the big toe. Big toe flexion and extension is super important in something called the Windlass mechanism. If you don't have good big toe flexion and extension, then you can't load the big toe properly, which means that you can't load the medial line of the foot properly, and also means you can't line the medial line of the lower leg properly, which means that you're more likely to have a medial meniscus tear. So working on your toe flexion and extension is super important to make sure that you can load it correctly. Now, things like hammer toes and bunions. Bunions I'm definitely going to do a separate video for, but actually it's more important that you know how to load the tarsals and the metatarsals first before doing any work on the toes. If you do a lot of work on these tarsals and metatarsals, I've actually seen people correct their hammer toes if it's just through something like wearing high heels. Obviously, if there's been a trauma or a specific injury, then that needs to be assessed and done slightly differently. Okay, hope you've enjoyed this video. If you have, do things up here, and I'll see you soon.